Sometimes with our heat setup at the beginning, we also use electrical stimulation as well. The main form of electrical stimulation we use is IFC, or stands for interferential current. This is to help patients feel a reduction of pain, as well as it can bring a little bit of blood flow to the area. The main purpose of IFC is to help with pain reduction. So for our patients that have particularly out of control pain, you might notice that we use an IFC setup in addition to the heat setup as well. So I'll also find those setups over here. We have the pads alphabetically organized here, so you'd go by the patient's last name and go ahead and find their corresponding pads. That way we keep everything clean and that we don't have patients using other patients' pads, because that would be unsanitary. So I go ahead and take the plastic sleeve out, and then I take out the electrical stimulation unit and unwind the cords. What I would encourage you to do is during this part of the setup is to find a rhythm and find a routine that will help you do this quicker and faster every time. For example, my routine was I found one channel. It has 2 leads on it, one wire with 2 leads. I would place the same channel on the bottom 2 pads that are here and here, and then I'd grab channel number 2 and I'd place that here on the upper pads like so. That won't be important for when you plug it in, but it will be important for when you're sticking the pads on the patient later. So if a patient does have an IFC setup in addition to their heat, what I'll do is I'll call the patient over, and then I'll get the unit set somewhere where it's not going to fall, so either on the table or it has a little clip that you can hook onto your pocket right there. Go ahead and turn around for me. We're going to do a lumbar setup today. So what you'll see here is that I'll take the top 2 pads and use them as one channel, and the bottom 2 and use them as one channel. And what we want to make sure that we do with every setup, no matter where it's at in the body, is that we box in the pain. How our IFC units work is that if his pain was right here in the low back, I would place the pad of one channel here and the corresponding pad here, so that they would create a line like so. And then I'd put another pad here and another pad here from the other channel so that it crosses like this. The maximal effect of this treatment is right where those 2 lines crisscross. So if a patient has pain right here, I'll want to make sure to box in that pain with those 2 channels as follows. So I'll give them a little untuck here. One thing to always be mindful of is if you're in an extra sensitive spot, that you might consider finding a room so you could have some more privacy and discretion. So I oftentimes with a belt, I'll pull it away and then slide in here. A couple things I'm making sure to do are not putting it on the bone. I'm not on the spine here, so you can use your fingers to feel, and we'll practice that over time. And I'm making sure not to put it on the bone of his hip. That's an important principle anywhere you're doing these pads in the body. We want to avoid hitting the bones. What I'm also doing when I put heat, ice, or electrical stimulation is I'm doing a quick skin check to see if anything looks out of the ordinary. If anything looks out of the ordinary, pause what you're doing, grab the provider that's working with them that day, and make sure that they come and check it out just to make sure that it's safe to do heat, ice, or stimulation on them today. The other thing that I was doing as I was going is I was making sure each of these pads stuck on flush and that the cords were plugged all the way in to the pads. Those things can create issues with the circuitry, which can make the IFC unit not work. So be sure that the pads are flush and that the plugs are plugged all the way into each of the pads. Now that you have them plugged in, they have a tail and they're not used to having a tail. So you're going to be managing the tail while they manage their bodies. Zach, go ahead and lay down on your heat pack for me. So my job is to make sure this tail doesn't get overstretched or doesn't get bunched up. We're going to lay it down like so. Now, one last tip for when you're setting people up is that the pressure in the pads makes a difference on how the patient feels the effect and intensity of the pads. Well, what does that mean? When he's sitting down, there's less pressure on these pads than when he's laying down. So I always want to make sure that the patient's in the exact position they'll be resting in for the 10-minute setup before I turn on the pads and the unit. So you press the power button to start. What you'll see here is in the top left corner, you should have the B circled because that's the right setting. And then there will be channels that you can turn on, one on each side. You'll see channel 1 and channel 2. What I do is I say the same thing every time. I say, Zach, you're going to feel a little bit of tingling, okay, sensation like little ants walking over you, okay? what I want you to do is let me know when you just barely start to feel it. The reason I do that is so I can be efficient and fast with this setup, because I don't want to go like this and do one at a time and then wait, because that just takes too long. I'll say, let me know when you start to feel it. We can have confidence that he won't have any pain or any issues if he's not feeling it yet. So I say, let me know when you start to feel it. And I go up really fast.
Starting to feel it.
Perfect. Now I'm going to go slower. Let me know when it feels strong but comfortable. You can see there's a little rhythm to my pace where I pause between each setup so that he can have a second to feel if that's the right level.
That's good right there.
Perfect. Are you sure I can go down one if you want?
Maybe just a little bit down.
Okay, I'll go down one. How's that feel?
Perfect.
Awesome. You let us know if anything feels different as we go. We can always make adjustments, okay?
All right, thank you.
All right, thanks. It's always important to confirm that the patient feels confident that they can go down one. Sometimes they have apprehension. They might feel like they're wussing out or they're creating an inconvenience for you. Please take that extra time to ask, are you sure that's okay? I can go down one. That helps them feel confident in getting the right level of stimulation. So in getting a patient off of the TENS unit, what you have to do first to unlock the intensity is to push the down arrows on each of the channels first. Then you can press and hold the power button until the blue light shuts off. And then you'll know it's off. You can always verify by saying, did the buzzing go away?
It's gone.
All right. Because you do not want to have the pads on your fingers while they are turned on. That will zap you. Does not feel good for you or the patient. Go ahead and lift up your legs for me. Good. One thing to make sure you keep track of is this clear sleeve here. Go and sit up for me. If you lose track of this clear sleeve, they are hard to find. So create a system with your team to make sure that you guys know where to find them. But you always want it close by so that way you can grab them and stick them on to the plastic sleeve. Now, I don't really have a system for this because at this point it doesn't matter if I keep the channels in order. I'm going for efficiency and making sure that I can get these pads off and back onto their pad.